Good morning. Welcome to our Alaska Collaborative on Health and the Environment teleconference, Nursing the Earth Back to Health, Personal and Policy Strategies for Preventing Breast Cancer. I'm Diana DeFazio, and I will be facilitating today's call with Dr. Catherine Dodd. CHE Alaska is a regional partnership group of the National Collaborative on Health and the Environment. CHE Alaska aims to advance knowledge and effective action to address growing concerns about the links between human health and environmental factors. You can find more information at akaction.org and healthandenvironment.org. Yesterday, I sent an email with a link to the presentation slides to everyone who had signed up for the call. If you signed up later and did not receive that email, please go to our website at akaction.org to download the slides. The link is under the title of today's call. And we invited Catherine Dodd to be our speaker this month in advance of her visit to Alaska next week with Katie Huffling, Executive Director of the Alliance of Nurses for Healthy Environments. They will be speaking at events in Anchorage and Fairbanks for ACAT's annual Breast Cancer Prevention Lecture Series, made possible by a grant from the Alaska Run for Women. And I'll give event and location details at the end of today. Now it is my honor to introduce Dr. Catherine Dodd. Catherine has worked in the areas of health policy and politics for more than 25 years and brings her significant expertise in the healthcare system as an RN, health administrator, and health policy expert to her current work as a health systems consultant. From 2009 until 2017, Dr. Dodd served as the director of the City and County of San Francisco Health Service System, where she negotiated and administered health benefits for more than 112,000 county, school district, and community college district employees and their dependents. Her distinguished career also includes serving as Region 9 Director of the Department of Health and Human Services under President Clinton and as District Chief of Staff to Democratic leader Nancy Pelosi. Her civic and community involvement includes service on numerous boards over the years, including the Breast Cancer Fund, the GLIDE Foundation, the Homeless Prenatal Program, and the Zen Hospice Project. Currently, she serves as chair of the Board of Directors of the National Committee to Preserve Social Security and Medicare and as a board member of Commonweal. Dr. Dodd has a Bachelor of Science in Nursing, a Master's of Science in Community Health Administration, and a PhD in Sociology from the University of California, San Francisco. Welcome, Catherine. You may go ahead and begin. Let me unmute your line first.
Thank you very much. Can everyone hear me?
Yes, we can hear you.
Okay. I'm starting this slide with the Breast Cancer Fund because that's really where my entry into the chemical causes of cancer began, was when we were still called the Breast Cancer Fund, and our byline was Prevention Starts Here. Next slide. We're now called the Breast Cancer Prevention Partners because that's really what the Breast Cancer Fund did, was it partnered with organizations which had different expertise or the same expertise so we could spread the work out. And we've been pretty successful. Of course, the byline now is exposing the cause is the cure. Next slide. So I'm going to talk about what we know and what we can do. And I want to give credit to Sharmina Rasanyagam. And Sharmina, I apologize if you're on the call and I didn't pronounce that correctly. She is the Director of Science at the Breast Cancer Prevention Partners. What's so impressive about the organization is that there are real scientists working there, as well as communication officers and a lot of other things. But this isn't just an advocacy organization. It's an organization that bases its advocacy on science. Next slide. So the numbers are staggering. The National Cancer Institute predicted that in 2015, 40,290 women and 440 men would die of breast cancer, and 231,840 women and 2,350 men would be diagnosed with invasive breast cancer in situ. In situ means that it's not yet metastasized. As of early 2016, the NCI estimated that there are approximately 3,560,570 U.S. women living with a prior diagnosis of breast cancer. Next slide. So I just want to say secondary prevention is screening for cancer. Think about a smoker having chest x-rays every year to see if he or she has gotten cancer yet. That's akin to having routine mammograms to see if we have breast cancer yet. We need to prevent cancer, not just screen for it and hope that we catch it early. I'll give a lot of information in this talk, but I want you to please visit the website bcpp.org to find out more and get tips on what you can do at home and in your community to both make yourself safer as well as to advocate. I'm going to give a brief overview of primary prevention and how we remove the cancer-causing chemicals from our environment, if it's possible, and to think about it in the context of our homes, hospitals, schools, workplaces, parks. The air and the water all have chemicals, carcinogens, and EDCs, which are precursors to the disease. It's hard to talk about breast cancer without talking about basic hormonal physiology. So the endocrine system is, next slide, I'm sorry. The endocrine system is comprised of glands that secrete hormones, which are chemical substances that travel in the bloodstream and target tissues where they regulate bodily functions, including the development of primary and secondary structures, including our breasts. Next slide. The basic structure of the breast develops early in the prenatal period before we're born. By birth, the nipple is well developed and the breast responds to maternal hormones. A few months later, the breast tissues become responsive to progesterone. In puberty, breast cells grow and divide rapidly in response to specific patterns and doses of natural estrogen, which is often called estradiol. Deep in the breast, the ducts grow into terminal end buds, much like the branches of a tree. The branching of the ductal system is impacted by progesterone. Throughout these processes, androgens, including testosterone, which is secreted by the adrenal glands in females, help us to regulate and balance the development of breast tissue. Next slide. So the complexities are significant. Breast cancer is not a single disease. On the next three slides, you'll see the ER stands for an estrogen receptor, PR stands for progesterone receptor, and HER2 is an oncogene. So when you think about breast cancer, it's classified in many ways. First, by age, or whether or not you're premenopausal or postmenopausal, with the age 50 being the proxy for the shift between those phases. In situ, as I mentioned earlier, localized, regional, metastatic, morphological characteristics, histological grade, and cellular proliferation rate, and then the gene expression profile. Next slide. So this gives you the basic explanation of how breast cancer is not a single disease. 50 to 60% of diagnoses are luminal A. They're estrogen receptor positive. They're low grade. They often have a good prognosis, and they have a co-expression of progesterone receptors and a low proliferation rate. Luminal B is an estrogen positive cancer that affects 15 to 20% of the diagnoses. It is low grade, but it has a faster growth than luminal A. But it does have a low or high proliferation rate and a low progesterone receptor expression. You often hear about HER2 positive. That's the oncogene. It's 50 to 20% of the breast cancer diagnoses. It grows quickly, but it responds to targeted therapy with or without the estrogen positive or progesterone positive receptors. The worst one is the triple negative, and it too is 15 to 20% of the diagnoses. It is estrogen receptor negative, progesterone receptor negative, and HER2, the oncogene negative. These are aggressive cancers and more difficult to treat. They're more common in younger women, especially African American, and to some degree Latinos. It does not respond to hormone-based treatments or targeted therapies. So the subtypes are not randomly distributed across the population, and there are differences found when the diagnoses are stratified by age, ethnicity, reproductive history, body mass index, and socioeconomic status. Next slide. So many exposures are linked to all those different kinds of breast cancer. And first we're going to go through some of the exposures, what we're worried about, and what's the science behind our concern. Then we'll talk about different times during our normal day where we're exposed to those kinds of risks. I'm on the next slide, the one with the smoke coming, the woman and her child and the smoke coming out of the stacks. It's slide 10. Everything I talk about is based on peer-reviewed research. We're looking at the primary prevention of breast cancer, stopping the disease before it starts. And we believe that this research also holds true for reducing the risk of reoccurrence. And we're doing more work on that. It, of course, also may affect other cancers, but we focus in on breast cancer. Next slide. So the three categories that we're looking at are carcinogen exposures, which are linked specifically to cancer. You hear the word carcinogenesis. Hormone disruptors, which disrupt the body's hormones, and physical agents, for example, light at night or radiation, both ionizing and non-ionizing. In terms of the chemical carcinogens, they've been shown to cause cancer by the World Health Organization and others. The hormone disruptors are often called endocrine disruptors, and they're chemicals which disrupt the body's hormone. And in particular, those have been shown to increase the risk of breast cancer in people or in mammary cancer in animals. And then lastly, the physical agents have been linked to breast cancer, and more research is needed on those. Now, next page. Alaska and circumpolar areas have increased concentration of what are called PBTs, which are a type of endocrine disrupting chemical. Persistent bioaccumulative toxic substances do not degrade easily in the environment. That's what a PBT is, persistent bioaccumulative toxic substance. PBTs are carried by the winds for long distances. The molecules are carried to the earth in precipitation and then evaporated from the earth again. When the winds continue to go north and the temperature drops, they condense out of the atmosphere, reaching higher concentration in those circumpolar regions. Because there's insufficient thermal energy to go through an additional evaporation cycle, they stay up there in the circumpolar areas. PBTs are released intentionally in the form of herbicides and pesticides, or unintentionally as a byproduct of combustion. PBTs are lipophilic. I mentioned that before. They accumulate in the fatty tissues and are very slowly metabolized, which is why many carcinogens are found in the body years after chemicals have been banned. I was one of the people 15 years ago who was biomonitored, and I still had high levels of DDT and other chemicals in my blood, even though I was born in 1956 and they were banned in 1965. They stay in your body. Humans and animals are exposed to PBTs in the environment through air, water, and food. They contaminate fish, marine mammals, and birds of prey. Next slide. Endocrine disrupting compounds, EDCs, have a different toxicological model. Higher doses are more damaging than lower doses in non-toxicological model. You'll hear the dose makes the poison. Well, these are just the opposite. They can be very, very dangerous in very low doses. Like natural hormones, at low doses there are physiological responses, and those responses may be greater or even different from what the exposure would be at higher doses. The timing of that exposure, whether it's during fetal development or just prior to puberty, also has different effects. There are scores of chemicals at multiple doses alone and in combination which have different effects, including adaptive effects. And they're found in our environment. BPA, bisphenol A, which the Alaska Toxics Coalition has done a lot on. BPA significantly increases the effects of estradiol, which we learned about in that endocrine slide. EDCs can alter the regulation of genes involved in cell proliferation through a process called epigenetic processes. They're powerful chemicals. Next slide. Low doses, especially during those critical phases of development, increase the risk of adverse health effects, including cancer, neurodevelopment, neurodegenerative diseases, metabolic disorders, asthma, and immune disorders. Some of them even interact with the molecules in the body that regulate cell growth and division. They affect the metabolism or the breakdown of hormones, and they cause epigenetic changes. There is extensive literature that supports the hypothesis that early developmental exposures, including but not limited to diethylstilbestrol, or DES, bisphenol A, also called BPA, phthalates, atrazine, and other pesticides and herbicides, and heavy metals, including cadmium and mercury, can increase later developmental breast cancer. Next slide, please. This is a figure that I actually got from Katie Huffling from the Nurses Environmental Organization. And it shows, the left side shows the cell receptor, which is locked, and it needs to be unlocked for the hormones to go through. So that those blue stars that hits the cell receptor and unlocks it, and you have normal cellular function. Those red duck-like things are the bad guys, the endocrine disrupting compounds, and they will fit right into that lock, and they will unlock it, and you'll have altered cell function. So it kind of gives you a sense of how this happens at the cellular level. Now on the next slide, which looks like for those of you who might have just joined, it looks like a box with different classifications on it. These are the carcinogenicity classifications and the sources of exposures for EDCs. Across the top, you have the EDC. Then you have IARC, which is the International Agency for Cancer Research. You have NTP, which is the National Toxicology Program. A number 1 under that IARC refers in humans refers to being a carcinogen. 2A means that it's possibly carcinogenic to humans, and 2B means and 2B means it's possibly carcinogenic to humans. 3 means it's not classifiable as to its carcinogenicity to humans. Under the NTP, the National Toxicology Program, now remember, the National Toxicology Program is the U.S., the IARC is international. Under the NTP, K means that it's known to be a carcinogen, and RA means it's reasonably anticipated to be a carcinogen. So as you can see, we already talked about BPA. It's a polycarbonate plastic. It's in resins. It's often in the cans of food. After you pour your soup or your vegetables out of a can, you see a goldish color. That's BPA. It's in dental sealants still, and it's also on those thermal receipts. They're kind of shiny. So whenever I'm at the grocery store, I tell people they should be wearing a glove when they handle those receipts, because you can imagine they touch them all day long, and those are absorbed through their skin. Phthalates, and if there's no rating in it, it's because the IARC or the NTP has yet to rate it. Phthalates are fragrance ingredients in personal care products and cleaning products and plastics. They're also in pharmaceuticals, building materials, insecticides, and food packaging and processing. you can just imagine what a huge classification of products those are, and it's hard to not come in contact with them every day. Diethyl phthalate is DEP, and they didn't say where those were, but I think it's a kind of phthalate that's in the fragrances or personal care products, etc. Parabens, again, are everywhere. They're antimicrobial preservatives in food. They're in personal care products, soaps, detergents, and pharmaceuticals. They're also in candles. So when you buy candles, look for ones that are paraben-free. And then alphenols, triclosan and triclocarbon, are detergents and cleaning products. They're antioxidants in plastic and rubber products. And they're antimicrobials in hand soap or other personal care products and household items. I'll point out that if you go to buy socks, I mean even good socks to keep your feet warm, they're often treated with triclosan, or biosan. They call it different. There are different derivatives of it, and they call it different names. So the purpose of it is to keep bacteria or things from growing in your shoes so your feet don't smell. But it's a high price to pay to be exposed to those just for non-smelly feet. The next page is more. These are broad categories, and I listed the reference from which this came on the last page. I didn't put down every single chemical, but hormonally active ingredients are found in sunscreens, and the source is the UV filters. Now, there's a coastal city in California that's banning sunscreens, not because they're dangerous to people, but because they're dangerous to sea life, which I think is interesting. It's a good move. Perfluorooctanic acid, or I may have said that wrong, but it's more easily remembered as PFOA, and the sulfate version, which is PFOS. Those are in stain-resistant coatings, in non-stick coatings, in commercial products, and which include firefighting foams. So you find those when you waterproof. If you buy the material that waterproofs your jackets in the winter, there are PFOAs there. The firefighting foams are significant because firefighters, of course, are exposed to large amounts of those. The polyaromatic hydrocarbons are byproducts of combustion resulting from fossil fuel production, diesel exhaust, grilled meats, and cigarettes. So imagine people who live near the highway. There's a tremendous amount of accumulation of those hydrocarbons. Triazine herbicides are used for weed control for corn and sorghum crops. Other pesticides and herbicides are used for termite control, residential or recreational crop pesticide, broadleaf weeds, insecticides, woody plants, and the list goes on. And I do want to do a shout out to the Alaska Community Action on Toxics, because they did some of the early work on this, working with ally organizations that compelled the U.S. Fish and Wildlife to cease the use of herbicides on Alaskan wildlife refuges and adjacent lands, and that was as early as 2009. They have a impressive list of things that they've accomplished in terms of eliminating these pesticides and herbicides, and I want to send you to their website to see those accomplishments. On the next page, page 18, we go on with the exposure for EDCs through persistent organochlorides, through PCBs, electrical insulation, plasticizers in paints, dyes, and inks. So those new outdoor paint that you put on to keep the wood safe or the construction things safe, those all have PCBs in them. The next list is dioxins and paradioxins. Moving down to PBDEs, which are, again, flame retardants, previously used in furniture electronics. Many have been voluntarily eliminated or phased out. And the Alaska Action Network for Toxic, I would say it wrong, the Alaska Community Action on Toxics currently has legislation to deal with furniture PBDEs. Aromatic amines are in hair dyes, the dyes used in textiles. We also find them in cooked meats, and again, the different ones that are in hair dyes. It pays to just go gray, I think. And then lastly, metals, cobalt, nickel, and lead. These are naturally occurring elements that are, but they're also elements that are in clay and metals found in cosmetic, toys, and other products. And then methyl mercury and cadmium and iron, which I mentioned before. These are naturally occurring elements, but they're also derived elements in the same classification. So when you think about that, those are the ones that are accumulating and then being deposited in the circumpolar area. So all of this information came out of the latest State of the Evidence that was written by Janet Gray, by Shamina Resen-Yagam, and by Connie Engel and Jeannie Rizzo. And that's available on our website, the Breast Cancer Prevention Partners. So we've kind of gone through the science. I'm on page 20 now. Let's talk about how we encounter these every day. We encounter them in the products we use, the things we consume. We encounter them at work, in the chemicals we may work with, and the conditions of our workplace. They're indoors, they're outdoors. They're environmental pollutants and other factors in the air we breathe and the water we drink, and the things we put on our body. Next slide. The federal government, our federal government, has failed to regulate these chemicals. The EPA is responsible for regulating industrial chemicals, pesticides in the air and the water. The FDA is responsible for regulating food and contact substances, which would be personal care products and medical devices. OSHA is responsible for making our workplaces safe, and the Consumer Product Safety Commission is responsible for making sure that kids' toys and the household cleaners we use are safe. The public, the vast majority of people, think that these chemicals are tested before they go to market. But as you know probably, this is just not the case. These different agencies with responsibility for protecting us are failing at the task. We need to do better, and we need to influence those agencies. Next slide. I wanted to talk briefly about the failure of the Environmental Protection Agency and the Toxic Substances Control Act. Now, we passed a new version, the first time in 38 years, we passed a new version of TSCA, and it wasn't perfect because all stakeholders had to weigh in, and they always say, you know, if you don't like watching sausage being made, you don't want to be part of the legislative process. So there were things taken out in the Senate version that we thought were important. Now the EPA is responsible for producing regulations based on TSCA that theoretically will protect us from those chemicals. Imagine 85,000 chemicals, 62,000 were just grandfathered in as safe, and 5 chemicals, only 5 were regulated. In California, we passed Prop 65 many years ago, and so there are more chemicals here, but new chemicals are being created every day that we're exposed to and that are just not tested. President Trump's appointee to the EPA, Secretary Pruitt, appointed Nancy Beck to head the agency's toxic program. She came out of the industry trade group called the American Chemical Council. And they're first promulgation of the regulations for TSCA, they completely ignored all of the input that had come from the public, and that included agreements from the stakeholders. It included bipartisan support, and essentially kind of threw away all the techniques we would use to identify and control harmful exposures to toxic chemicals. So after all the years we went through trying to get that legislation passed, the regulations now don't live up to what we had hoped. So again, during the day, next slide, we encounter what can we do to reduce the chemicals that we're exposed to. Again, many of these chemicals can be found on our website, as well as on the Environmental Working Group's website, Think Dirty. I want to stress, though, that not everyone is going to react the same way to the different chemicals. Again, we talk about timing matter. The timing matters. The life stage of prenatal, in utero, childhood, pregnancy, and the ages right before puberty. Those are times when cells are developing rapidly, and any change to the hormonal balance can cause changes in breast development, which decades later can affect breast cancer risk. The underlying susceptibility of individuals matters. For example, the BRCA1 and 2 genes, or people who carry BRCA1 and 2, are less able to repair DNA damage caused by ionizing radiation than others. So they may want to vary or be wary of the use of X-rays, or they may want to not work with ionizing radiation. Societal factors matter in terms of these exposures. We all know that we should eat healthy and exercise regularly, but not everyone has the opportunity to safely exercise, particularly in the circumpolar areas where it's cold, or many people don't have access to healthy food, especially when you have shorter growing cycles in cold areas. A social stress is beginning to emerge as an important factor in determining the risk of breast cancer. And we need to do much more work on how to mitigate these risks. Finally, we're not just exposed to one chemical at a time. We're constantly wading through a soup of exposure, so that our chemical body burden is like a soup of chemicals. They may be present in dozens of products that we use in combination with others. It could be in your sunscreen or in the lotion you put on your dry skin, and then you go eat from a canned food that has BPA in it. So you're mixing those chemicals in your body. We worry about the products, especially because the doses that matter are so tiny. We should try and avoid that exposure altogether. So page 25, think about your morning routine. Most of the ingredients in cosmetics can be found on our website or the EWG Think Dirty Healthy Living Good Guide. And those can help you choose products that don't have dangerous chemicals in there. It's helpful to go to a reputable third-party program to identify those chemicals. This is an area, though, that needs collective action. And we've actually been successful when we can't get legislation through. We've been successful just using market power and saying to some of the nail polish companies, we're not going to use this nail polish because it has toluene formaldehyde in it. We were successful in eliminating the BPA from baby bottles. And as a nurse, we used to warm the baby bottles up in the microwave before we gave them to the baby. Well, here you have plasticide, you have plastic seeping into what we're feeding new babies. There's no law against doing that, but we don't do it in health facilities anymore. Next slide. So this failure of the Food and Drug Administration is significant. We've introduced over 1,300 chemicals since 1938. The European Union we've introduced over 85,000 chemicals since 1938. The European Union has eliminated 1,300 of them. The FDA has only eliminated to date 11. This cosmetic industry is extremely powerful. It's worth about $71 billion a year, and for people who don't wear a lot of makeup, they think, well, I don't have to worry about it. I don't wear makeup, but even your basic cream that you put on may well have carcinogenic or EDCs in it. Next page. We launched when it was the Breast Cancer Fund, now Breast Cancer Prevention Partners, we launched the Campaign for Safe Cosmetics in 2014 and really focused on nail polish, hair color, hair straighteners, which is an interesting category. Hair straighteners are often made from placenta, and they're very, very high in hormones, but they straighten kinky hair. Who would have known? We've found dangerous chemicals in eyeshadow, eye pencil, and then the most insidious one are the fragrances, because they hide under this. This is a trade secret. And I'm going to speed up a little bit because I've only got 7 minutes left. At any rate, the things we put on our body are significant. On the next page, here are some of the lists and where you find them. Formaldehyde, dibutyl phthalate, coal tar. It's really expensive. It's really extensive. On page 29, you think about sending your kids to school. What kind of pesticides are used in the playground or in the buildings themselves? Again, Alaska has passed some really good legislation to protect schools, but non-public buildings are not regulated the way our schools are. What's in the soap in the bathrooms? Is the soap safe? So there's an opportunity for you to ask those questions as parents and relatives. The next slide, what's being served at lunch? Is it fresh organic food, or is it food out of cans lined with bisphenol A? Or are they being served in plastic dishes that are microwaved? We really have to look carefully at where our kids are being exposed, particularly because they're at such an important age group. On the next slide, we talk about workplaces. The Breast Cancer Fund just released last year a report called Working Women in Breast Cancer, the State of the Evidence, and I'll list two. We also just did two, or they also did two new published articles that are just coming out on work in female breast cancer that reviews the literature. The recommendations are that we need more and better research. It's hard to categorize all those different things and get a large enough N to study it over time. The report identified jobs where you're more likely to be exposed to breast cancer risk. Beverage production workers, hairdressers, cosmetologists, nurses, doctors, medical workers, women who work with solvents, even teachers and librarians. So some of these risks can be linked to chemical exposures. Others, we've called for more research on them. In the meantime, we have to ask for transparency, and we have to wear protective equipment. We're doing research on the firefighters, women firefighters across the country who have a much higher level of breast cancer, and we're doing biomonitoring in a longitudinal way. But because we need a large enough N of participants, it's difficult research to do. After school, what happens? Kids wash their hands, and maybe there's triclosan in that soap. One of the precautions you can do is to take your shoes off at the door and just wear warm slippers. Our outdoor time. What on the next slide, 33? What do some of our UV filters? What do some of the sunscreens have in them? Those UV filters stimulate estrogen production. Choose sunscreens that have no non-nano titanium dioxide, or just wear a hat and sun-safe clothing. The next slide is food prep. We talked about safer cans, but for the time being, if you can, limit the consumption of canned foods. Be careful of non-stick cookware. That Teflon is just made of PFOAs. Non-stick pans. It's hard to imagine cooking in an old-fashioned iron skillet, but those are probably safer. On the next slide, cleanup time. What's in those personal care products? What's in the products that you're taking off the shelf? Again, we're working to change those laws, but consumers, until we do change them, have to take responsibility themselves to protect themselves. Next slide is electronic disposal, the disposal of batteries. We want to make sure we dispose of electronics safely so that they don't pollute our living space. The next slide is bedtime. Are there flame retardants in your mattresses? We've proven that the flame retardants, the chemical industry has fooled us all this time. And if you just hit a pillow or a mattress, you can see the dust coming up. And those are flame retardants, which are known to be causing risk for cancer. The next slide, nighttime light. If you're outside, it comes into your bedroom, consider trying light-blocking curtains. It's probably especially important when you have longer days. Try to make your sleeping space free of blue electronic lights as well. You'll sleep better without that blue light. That mechanism is still being studied. We don't know if it affects the melatonin levels, but it's important to have a dark sleeping space. So the next slide, the recent literature review identified the social determinants of health as risk factors. 4 themes emerged. The breast cancer prevention partners is working in a large coalition to write a plan for California that will hopefully be used as a plan for the other states in the country. And the themes that initially came out were neighborhood and economic factors and segregation influence the risk, local exposures, urbanization, trauma, and hunger. And those social determinants of health, I just put a page in about what those are considered to be, but they include occupation, community stress, the security, built environment, and social networks. It's clear that cumulative stresses of racism and discrimination, socioeconomic, psychological, and environmental stressors, that changes the allostatic load and may dysregulate physiological responses. So both the social history and personal life history are taken into consideration when we look at breast cancer risk. The concepts aren't fixed. Tumors change, and even receptor sites change. And we need to do more research on this. And I mentioned the next slide, the 2 soon-to-be published articles, the State of the Evidence and Work and Breast Cancer Recommendations to Address Research Needs. we need to do more research. So what can we do? Well, we can get informed, we can shop smart, and we can advocate. And as individuals, we can take action in the last slide. We can take action in our home, at work, and in our communities. We have to continue to lobby the FDA. We have a proud BCPP has a proud history of working with Alaska Action for Toxics, and people like you. We'll continue to do this work, and we hope you'll join us in our mission to eliminate exposures to toxic chemicals and radiation linked to breast cancer. And there are two bills currently in Alaska, HB 27 and HB 53, that the legislators need to hear your voice on that. And with that, how much have I gone over?
Oh, this is Diana. Catherine, you're just fine. We like to leave about 10 minutes for discussion. So if you wanted to take another minute or two,
I'm fine.
Okay.
I think I've
Okay. Well, we'll move on to our discussion then.
Great.
And thank you very much for your presentation. There's a lot to go back to there that I want to study when making my choices about what to buy. Seems like the list just keeps getting longer and longer of things to avoid. Now it's our time for discussion, for questions and comments from our participants. And this is a little bit different this time. We're using a different service. So if you would like to ask a question, you're going to need to press *1. This will show me that your hand is raised, and then I will be unmuting your line. So again, *1 to let me know that you have a question. And when you're done, just like as soon as I've acknowledged you and you're asking your question, you can press #, which will just lower your hand. Don't know that that's real necessary. Okay, so it looks like I have a question. So just one moment here. Go ahead.
Hi, this is Patty in Anchorage, and I wanted to thank you, Dr. Dodd, for all that information. Oh, I guess you're not yeah, you are. You're a PhD. Anyways, thank you for all that information, but I have to say it was a little overwhelming. So what I would like to know is let's assume that my house is thoroughly contaminated with all these things and that I have all these products in my medicine cabinet and under my kitchen sink and whatnot. Could you give me and the rest of us maybe a little heads up on if you had to start somewhere with the really worst yucky stuff, where would we start? Would it be, the shampoo or the microwave or the bisphenol A in the cans, or where can we get the biggest bang for our buck just to get started and then continue on through all the other things that you've suggested?
Okay. Well, I would start with going to the website to look at what's safe. And it really depends on what you do. If you do a lot of cleaning, start with vinegar and water. If many toothpastes, if you look at what's in them, many of them have triclosan or biosan in them. So you can still get fluoride, but you don't need to have all these antibacterial, antimicrobial things in your toothpaste. Think of things that you use every day, that there's a cumulative, bioaccumulative effect of them. Now, some of these are not all of them are lipophilic, so you do pass some of them through, but just think of the things you're exposing yourself to. Obviously, if you garden, you want to really avoid things like Roundup, and look at using more natural things to eliminate weeds, etc. That's a really dangerous place. But I imagine if you're living somewhere where there's long days of sunlight, be careful of the kind of sunscreen you use, because you're putting it on over and over again, sometimes in one day. The Breast Cancer Prevention Partners divides up personal care products, household cleaners, and makes suggestions for you to do. So I would just go to the website, and I just realized that on the first page I did the website wrong. It should be BCPP, Breast Cancer Prevention Partners. And they're really good tips that are simple in terms of cleaning out.
Thank you, Dr. Dodd. And thank you, Patty, for your question. I'm going to go ahead and mute your line again, Patty. And just again, if anyone would like to ask a question or make a comment, please press *1 to indicate to me that you would like to make a comment or ask a question.
And I know that there are some experts on the call who might want to add something that I left out or emphasize it or correct it.
This is Mary Gant with Green Science Policy Institute. The FDA finally, after years of debating about triclosan, has prohibited the use of it in soap products. Not in toothpaste. You still have to read the label on toothpaste. Colgate, with its whiteners, has triclosan in its toothpaste, but the old-fashioned Colgate does not. And the only way to know there is really just to read the label.
Thank you. And can I ask a clarifying question? Is toothpaste something where they have to list all of the ingredients then?
You know, I'm not sure if they list, well, the list is too short to have all the ingredients, but they do list whether or not it has fluoride and the kind of fluoride, and then if it has triclosan in it, that's listed.
Okay, so the thing we're most concerned about is something we can find on the label.
Yes.
Okay, thank you.
And I have a question about hair dyes. I know there was a time when one of the black hair dyes caused kidney cancer, and I think it was changed. Has there been any progress in improving hair dyes? And some of the hair straighteners were contaminated, used formaldehyde, and has there been any improvement there?
I know that, this is Catherine, I know that there's been improvements. There are safer choices. And I think the worst one that we looked at really early was the black tar hair dyes. But there are safer alternatives now.
Good.
Thank you.
Thank you.
Let's see. I also wanted to know, but I'll have to unmute your line at the ACAT office. Just, did you want to say anything about the state legislation? I've just unmuted your line.
Okay, yes, thank you, Diana. This is Pam from the Alaska Community Action on Toxics office. And Catherine, thank you for mentioning our, which is the Toxicfree Childrens Act, HB 27. And this is a bill that would phase out all organohalogen chemicals in children's products and household furniture. So it's quite comprehensive in that it phases out a whole class of chemicals. We were really pleased to be able to get that included in the legislation this time around, and very grateful to the sponsor, Representative Garantar, for foresight to do that. The bill hearing in the House Resources Committee and actually passed through that committee. We were very pleased. We had many, many letters of support from healthcare organizations, Native tribes and organizations, firefighters, and many individuals weighed in. We had a lot of support for the bill. Unfortunately, it stalled in the House committee, and the legislature is winding down for this session, but we have high hopes that we will be able to enact it in 2019 during the legislative session that will begin in January.
Thank you, Pam. I do want to invite anyone else who would like to ask a question or make a comment to do so. Again, you would press *1 so I can see that you'd like to participate. It looks like I don't have any more questions or comments. So I think what I'd like to do is go ahead. Dr. Dodd, if you have any final remarks you'd like to make, and then I'm going to talk about the events that will be next week.
I just wanted to ask Pam, I know Alaska has a short legislative session. When they go back to their hometowns, do people see them or meet with them? Are they kind of still on duty even though they're not technically in session?
Okay, thank you. Yes, good question. The legislators do make themselves available during the interim, and we have a plan to hopefully build the momentum throughout the intersessional period in the summer, fall, and leading into the winter, leading up to the session in early January 2019, so that we can really keep the momentum going, build public support, organizational support. And I have to say, I really want to thank everybody who has weighed in on this, either individually or by getting a letter of support from their organizations, because it has been very effective, and I think the legislators are really message. So the breast cancer prevention lecture series that we have coming up next week, and Diana will talk about Toxics, is also an opportunity to help build support for the legislation.
Thank you. Catherine, anything else before I talk about the events next week?
No, thank you for this opportunity.
Thank you. Thank you so much for giving us a sneak preview of what's in store for next week. So anyway, I want to thank everyone for participating today, and we hope that you can join us for one of our events in Alaska next week. We have events scheduled in Fairbanks and in Anchorage with Catherine, who will be joined by Katie Huffling, who I mentioned before. They will be speaking Wednesday, May 9th at the Blue Loon in Fairbanks, and on Thursday, May 10th at Alaska Pacific University's Atwood Center, Rasmussen Hall. And both events begin with a reception at 6:30 p.m. where you can meet the speakers, and their talk begins at 7 p.m. And again, we want to thank the Alaska Run for Women for making these events possible. Is there anything else to add about the events that you'd like to add to that?
Well, there is one more event in Fairbanks, well, actually in North Pole at 4:30 at the public library on the 9th.
Okay,
so we
thank you.
Really welcome everybody to attend in Fairbanks or Anchorage.
And information about those events can be found on our website at akaction.org. So lastly, just before I close out the call, I hope you will consider making a donation to Alaska Community Action on Toxics in support of our monthly Alaska calls, and your contribution of just $10 or $20 or more will provide the support we need to continue bringing you these calls each month. You can give online at akaction.org. If you have additional questions or comments, please feel free to contact us. Phone number is 907-222-7714, or you can also contact me by email, diana@akaction.org. I will be sending an email out later with a link to the recording, as well as some links to some things that were mentioned, such as the State of the Evidence report that Dr. Dodd mentioned. So you will be getting that if you came in late to the call, or if you'd like to share it with someone else, you will have that recording. So thanks again, everyone. Have a wonderful day.